Hi, everyone, and welcome back to another conversation on Birth the Middle Way. I'm Sammy Love, and I'm really excited for this conversation today. We have a unique circle here. We are going to be talking to a beautiful mama, Karina, and exploring her unique birth story. And we also have the honor of having her midwife in the space with us to discuss this birth, this story, this unfolding. And we're really excited to weave these different perspectives and different experiences into this conversation. And so, yeah, Karina and I actually met, what would it be, 5, 6 years ago? She
Something like that.
did my Sisters of the Moon program, and we connected over womb medicine and the cycle, and really just, stepping deeper into our womanness. And she reached out and offered to share your really profound and beautiful birth story. And so, as those who have been listening know, Birth the Middle Way is very much so rooted in the intention to dive into conversations that are a little bit more nuanced. And you have a really beautiful story in that your waters were open for 5 days, correct?
Yeah.
And so we're gonna explore together, that layer while exploring many other layers of your experience. And so I would love to just kind of turn it over to you, Karina, and maybe you can share a little bit about your early processes in terms of, finding out that you were pregnant and really what your process was in terms of determining the type of support that you wanted for your birth, meeting Fadwa, choosing her, calling her into your space, and then we can kind of dive in and let it flow from there.
Awesome. Um, as I mentioned to you before, I've been listening to your episodes, and something Emma said once, someone asked you like where your story started. And
Yeah.
you're like, where do I even start? So yeah, where do I start with mine? But there is a portion of it where it started before I got pregnant. Um, so I met Fadwa when I was working at a chiropractic office in 2017. And she was a patient, and our chiropractor allowed her to share a lecture on home birth, which that was the first time I've heard about home birth. So yeah, I started just learning more about her and just being interested. And we've actually sweated together as well. She's a water pourer. She has taught me beautiful things in this way. And she even taught my husband the ways of fire keeping. And so we were already forming a relationship. And then a dear friend of mine got pregnant in 2019. And that was just a spark of like remembrance and excitement. And I was like, you know what? Let me just look up doula programs online. Is there any? For a moment I thought like maybe it could be a career, but it was more of like I just wanted to know and support my friend and my sister. And my course ended February 1st and she gave birth February 4th. So it was like super divine and amazing. And that was the first time I got to attend a birth with Fadwa. And I've attended like maybe four or five with her. And just being in that space was super beneficial for me as well. I knew when I got pregnant or whenever I was going to get pregnant that she was going to be the midwife. She was one of my choices, and I just knew in my soul. So yeah, I got pregnant in 2023. And at that point, Mafadwa and I had like a little bit of space, probably like a year and a half or two of not attending births or even speaking. But I knew that her practice is called Midwife 360, that I just was gonna go with her. And I've had several friends also birth with her. So yeah, my waters were broken for 5 days. I didn't know it was gonna be 5 days. But I did have a friend that she supported that her waters were broken for about 3 days. So I just knew that Fadwa, she knew the space. She could hold it and was just, and yeah, just I think that was like imprinted in my soul and in my heart, even though I didn't know that was going to happen to me. So yeah, uh, my waters were broken for 5 days. And I'm so thankful that I chose Fadwa to be there because it was so initially when my waters broke the first day, I had the programming of like, you see the TV and they're like, the water's broken, you have to go straight to the hospital. I don't relate to that, but just seeing so many movies and it being imprinted, I was like, oh my gosh, I had a moment of being a little nervous. So Fadwa also has other midwives in her practice, and I went the next day to just make sure everything was okay. I even had an appointment with them anyways. And one of the midwives was like, why are you so worried? It's okay. You know. The other thing I'm thinking of is I supported a friend that had a birth center birth and her waters were broken and they had her running around, like going to the chiropractor, getting acupuncture, and then sent her to the hospital. So I think that was also like a moment of like, could this happen to me? Would they do this with me?
Did you at any point feel as though there was a bit of a time crunch happening for you? Like, were you in kind of that state of consciousness at all after the waters broke of like, or did the midwife team kind of calm that nervousness when
They
you went in
calmed
for
that.
your
When I
check?
went into the office, they're like, no worries, no rush. Like, I was like, oh, okay. I was just putting that onto myself. So yeah, there wasn't pressure from the midwives.
No, there
I'm
was
so thankful
pressure
for
from
that.
the grander collective birth movement, no?
Exactly. And just my experience seeing, a mama being transferred, I'm like, I knew that I didn't want that. So, um, yes. So the way that also Fadwa's practice works, she had at the time 3 midwives. So there's a midwife on call, and then, or I'm sorry, the midwife, and then there's an on-call midwife, right, Fadwa?
We've had so many different paradigms.
Okay. Well,
Yeah,
when I
there's
was
typically one mid, yeah.
so it wasn't a guarantee that I was going to have Fadwa as my midwife. But it was so divine. It was her week to support me. So there was only a little bit of pressure because we weren't sure if her other midwives were going to support my waters being broken so long. But we literally like started the week together. So it was perfect. So my waters broke on 3/25, March 25th, 2024 at 3:30 a.m. And it was actually the lunar eclipse, I believe, as well. So it was like just really, really, yeah. It's like my waters are breaking with the moon, and I gave birth March 30th at 10 a.m. So that was a little over 5 days of my waters being broken. So yeah, during that time, I think maybe it was the second day or third day, we talked about natural inductions of doing some tinctures and doing some breast pumping, just to move things along, just in case I went past Fadwa's time with me. So,
And so this is a really interesting topic, having your waters open for so long, because there is this idea, as you already shared, your waters break, rush to the hospital, and it's in the same vein as birth has to be traumatic. Birth is really difficult. Birth is painful. When everybody's experience with birth, every woman's journey with birth is so different. And so I'm really curious. One of my main questions here is when our waters are open, the risk of infection can be elevated. But in your case, from what I'm hearing, infection symptomology didn't present. And so what made your waters be open safe in comparison to someone else? Oh, honey, you're muted.
And maybe with that question we can pivot into Fadwa sharing a little bit and
Mhm.
and maybe coming towards answering that question. But Fadwa, maybe before you get into answering that question, you could just present yourself and just share a little bit about your path as a midwife and your experience, and then maybe weave into the question and the topic.
Mhm.
Sure. Um, Listening to the episode that I did last night, I had to smile because you guys multiple times projected into the future of when you're a 70-year-old midwife and how you're going to just have this knowing. And I'm not far from that. Let me just say. um so
And it's an honor to sit with you because of that.
well, and there is a definitely some knowing that comes with the years, and at the same time, I still know that I don't know everything. I'm still learning. all the time. So, so as a midwife, I'll try to make it quick. Somebody handed me spiritual midwifery when I was 19, and that opened my eyes to natural birthing. When I was 17 in sociology class in high school, I wrote my thesis or dissertation or whatever paper you have to write, your big sociology paper, on intentional communities. And the farm was one of the ones that I looked at. So I had just somehow the universe had brought these things into my attention as a kid. And once I read Spiritual Midwifery, my intention was to become an OB that was helpful to midwives. But then I made some various life choices, did not go to medical school, instead became a nurse and ultimately a nurse midwife. I've given birth to a doctor, so I do have an OB in my family at this point, but I myself did not go to medical school. So I started like just absorbing everything at that time, at that age of my life, in my early 20s. I had my first baby when I was 24, and I had a free birth, even though I didn't know that that's what that was called. It didn't have a name back then. That was in 1985. I had a subsequent free birth as well, but the rest of my children, I have 6, were all born at home, but with the various help of either a friend or a midwife friend or somebody. I had somebody with me. And I have some thoughts about that as well in terms of that in relation to free birth that maybe we can share later. But I then went to nursing school and from there studied as a home birth midwife, never fully completing that. Life got in the way. I married a man with 3 kids. We had 3 more, so now we have 9 kids. My life got very busy. When that relationship ended, unfortunately, that's when I went to midwifery school as a nurse midwife. So I finally became licensed as a nurse midwife in 2005 and have been working in Florida ever since. Always trying to bring my the parts of my life together. And so my second husband is a spiritual leader in the Native American community. We have our Sundance family out in Colorado, and it's a ceremony that I attend every year. I've been going for 30 years of my life. Have danced for 7 years out of that time, but now I go and support. But always wanted to bring that, that into my life here in Florida. Bring the sweat and the teachings and just the beauty of how that connects life in so many ways. And was honored to work with Karina and Joey during that time. We had a lodge set up for about a year, and it was really beautiful. We did monthly lodges and really honored women in that way. And so as a midwife, I come from this home birth, like really rooted in home birth. But then I got my nurse midwife degree and I came out to Florida and I worked for this busy doctor practice and I became like this super midwife. I was the first midwife they hired into their practice. I wanted to learn it all and do it all. And I did, to the point of really burning myself out. So after 8 years, 1,600 births in the hospital, seeing over 400 women a month in the office, my body said, you can't do this anymore. You're killing yourself. And my arms decided to stop working. And so I stepped back and I realized the only thing I could do really was to shift, to offer something different, because what I was doing in the hospital wasn't in alignment with who I was as a human. And I found myself protecting women, or trying to protect women, from C-sections, and ultimately from their choices that they made. And I realized I can't protect people from the choices that they've made. They've made those choices, and unfortunately they need to see them through. What I can do is offer a different choice. And so that was really the impetus and the direction for Midwife 360, was to come out and, make a different choice for people. And so that's what I've been doing for the last 11 years. As far as water breaking, the thing that makes it dangerous is when people keep sticking their fingers up in there. So, somebody's water breaks and you go to the hospital, it's like the nurses, they constantly want to know where you're at with your vaginal exam. not paying attention to what they're seeing in front of them. Like, our attitude about it is, if you're wanting to push and you've been in labor for a couple of hours and your water's broken, that might be a time to check to see if maybe if you really are fully dilated and ready to push. I don't know. I honor women's bodies. You're probably ready to push, but that's not always the case. We've seen that to be different sometimes. But if somebody's water's broken, we're really trying to keep our fingers out of there unless we have a need to check. So for Karina, her water was broken. She was not having any kind of crazy contractions. She's fine to do her thing. She's going to get more work done alone with her partner or with her doula at home than she will having a bunch of midwives present. And there's no need for us to be there if there's not much happening. I think we offered an NST
So
in the
can
office
we
that day.
pause for just a
Yeah.
moment? And I'm just curious, Karina, when your waters broke, and Fadwa, you just mentioned that she wasn't having any crazy contractions. Can you guys describe the types of contractions that were present and when they really started to get stronger?
Yeah, so that was Monday. I believe Tuesday is when I started feeling some stronger contractions, but it was like period pains, really. And they were about like 30 or 40 minutes apart. So yeah, and then I believe Wednesday is when I started taking the tinctures and doing like the breast pumping to start. And that's when they started coming a little bit closer together and were a little bit stronger. And I think that was like 15 to 20 minutes. But then that was like in the evening time they would get closer, but during the day they would get further apart.
And so what were you doing during the day? Like, were you keeping up your regular activities? Were you keeping close to home?
It's funny, I was talking to Fadwa like and just sharing my story, and something she does or at least for me, she's told me to write down my birth story, like what that would look like.
Mm-hmm.
And I said I would go to the beach and go to the park and go for a walk. Did nothing. I also see birth as like a ceremony and just seeing like where I can integrate in life. And I was like, oh, like I could do that with my daughter. Like if I'm feeling it, let's get up, let's go to the beach, But I was at home for most of the time. I think I was very in my head at times with trying to do the tinctures and the pumping. And again, seeing that a reflection of myself where I could have maybe just gone out and just taken a
Was
little
that
breath.
something that you did intuitively, instinctively, or Fadwa, was that something that you recommended for her to start trying some types of natural induction? What was the process that kind of led up to that choice?
Fadwa and their midwives recommended.
We had it. Can you guys hear me?
Mm-hmm.
Yeah, we had a conversation. We must have had a conversation over the phone. We didn't do an actual official labor check until the 28th. So 3 days later. So we had a conversation initially. Well, okay, what do you want to do? It seems like your water is broken. We give them a piece of pH paper to help determine if it is indeed the water or something else, discharge, whatever that could be coming out. And we decided that it was water. She had continued to leak. That's another sort of clue that it's the water. And we always offer castor oil, herbs. We use cotton root bark and black cohosh. We will at times use a very low dose of Cytotec or misoprostol in the cheek.
And can you describe what those things do before you go on, just to educate the listeners?
Yeah, the castor oil is intended, basically it's a laxative. It's a pretty extreme laxative.
Yeah.
And the belief is that it irritates the bowel to the point where it also irritates the uterus. It's like a smooth muscle irritant or whatever, and that triggers contractions. The black cohosh and the cotton root bark are basically what used to be B&B, black and blue cohosh, and these are herbs that cause the uterus to contract. They can work quite well to induce labor when we're trying to do a natural home induction for one reason or another. Most of the time, we trust birth, we trust labor, we trust bodies, we trust it all to happen at the right time. But sometimes it feels like it's important to have the option to nudge things along a little bit. And the
And
meso
in what
is
circumstance would you want to nudge things along a little bit?
so when we're looking at getting close to or past 42 weeks. So my understanding, and I did not make this up, so if you haven't heard it before, it's not from me, and I can't tell you who did, but it's so like it's so divine that I have to use it. So the standard of care, think of the standard of care as the trunk of a tree. And when you're going to deviate from the standard of care, when you're going to go off on a branch, for instance, home birth is a deviation from the standard of care. Most babies in South Florida are born in the hospital. And so if you're going to do a birth at home, right there, you're deviating from standard of care. And when you're going to deviate from standard of care, you really want it to be client-led. You want somebody saying, this is what I want. Will you help me do this? So when it comes to breech at home or breech vaginal birth, when it comes to prolonged rupture, when it comes to prolonged pregnancy, when it comes to almost anything where you're still safe, the OBs are saying that you should get induced right now because of your age, for instance. I don't believe that that's really a thing if you're a healthy person. And so if you don't want to be induced, now you're going off on a limb, you're going off from the standard of care. And, we have to just understand this is what most doctors would do in this situation. I'm willing to support you over here. And this is what that looks like. So, inducing for prolonged rupture is a deviation from the standard of care, at least inducing at home. And so when she's first ruptured, we tell her, go home, expect labor, don't put anything inside the vagina. You could take a bath, you could take a shower. I've had doctors say that it might be okay to have sex in certain situations, but I feel like we just don't know. We don't have a crystal ball. We don't know how long this story is going to go. So if we can do things to reduce our risk of rupture, let's maybe not have sex. And we have the mom check her temperature every now and then to make sure that she's not developing a fever. Watch for normal fetal movement. That's the other thing.
Right. Okay.
The baby should move the way he or she has normally been moving.
And so an issue with putting things in the vagina, even a nurse or a doctor with gloved hands, because there's a lot of people, I've been told, well, when there's gloved hands, doing a cervical check, that's safer because it's sterile. And I'm curious to hear your thoughts on that.
Yeah, I don't think so, because whether you have sterile gloves or non-sterile gloves, the vagina is not sterile. The vagina is considered a dirty space. It is similar to your gut, although probably cleaner than your gut, but it does have certain normal bacteria, flora and fauna that are not found in the uterus, that are just in the vagina. And they're there. It's good that they're there. The baby needs them to be there. Your vagina needs them to be there, but they don't need to be pushed up into the cervix.
Right.
Right.
Is my thought.
Right. And beyond that, right, when we enter a vagina is it's a very dynamic space, right? And so it's not like it's just closed 100%. And as you put your fingers in, there's complete 100% suction, right? There's always going to be some bacteria from the external environment, even if the gloves were sterile beforehand, that enter as well, right? And depending on a moment, we're all women, so we know the way that a vagina works, right? But the vagina sometimes can actually bubble, right? And pull air into it as well as something enters it. And so, there's a lot of factors that are, we can't really control for just because we're sterilizing it. We're using a pair of sterile gloves.
Mm-hmm.
Right.
Mm-hmm. Yeah. Amazing. Okay. So then Karina, you're in labor and you're about 3 days in and you're taking some tinctures and doing all of these things. as per direction. And Fadwa, you were talking about those directives of castor oil, black cohosh, blue cohosh, all of these other things. And you mentioned two, I think they were medications, and I can't recall the names of them. And I'm curious what those do and yeah, why you mentioned them.
Yeah. So we actually don't use blue cohosh because there's
Oh, you don't? Okay.
some concern with blue cohosh. So we use cotton root
Okay.
bark instead. And
Cotton
then
root
the
bark.
medications that we might use, it's called misoprostol is the like Latin name or whatever. People also know it as Cytotec. And Cytotec can be used a number of ways. It's off label in the OB world. I think its main use is as a stomach, some kind of drug for the stomach, but it is used by doctors in the hospital to induce women. They typically use a very small dose, 25 microgram dose in the vagina to make the cervix soften and ripen and get ready for an induction.
And how would
And
this be
it's
administered? Would this be via needle, like injection? Would this be
so
kind of more
it,
like a
it
suppository, like a vaginal suppository?
it's a pill, and they'll put it. We have clients put it in their cheek because it has a slower it has a pretty quick effect, but it doesn't have as dramatic of an effect on the cervix if you use it buccally or in the cheek as it does if you put it vaginally. And I've never seen the one issue that people worry about with Cytotec induction is something called tachysystole, which is another name for uterine contractions that are just coming too fast with no rest in between. And this can be a problem when you're giving Pitocin in the hospital or over medicating in the hospital. And then they give another drug that's called terbutaline to relax the uterus and slow it down. And I've used the Cytotec at home for a handful of cases where they're a little higher risk, where there's um, a little more need, we need to get this person in labor because we're like going late in the pregnancy or we have a prolonged rupture or something like that. And it can work sort of like a last ditch. The person doesn't want to transfer to the hospital. Okay, well, let's see if we can try this to get you into labor. Because I think up till then, Karina's contractions, they would come, but they would go. And they would come and they wouldn't be super regular or super intense. And then they would kind of go away. And she just did this for days. I think it felt like at one point that there was a lot of people around. And I feel like at the moment where you sort of told everybody to leave, like that's the night that you really got down to business.
Yeah.
Oh, I'd love to hear you speak into that a little bit, Karina.
Yeah, I think, and part of me wanted people there, especially a few friends that haven't witnessed birth. And
What was your desire there in terms of wanting, like, were you
so
feeling like you wanted to gift them the ability to
yes,
see birth? Yeah.
yeah. So my vision is, I think Emma, you also said this, like we're all doulas, but like I see like back in the day, like sisters and wives and aunties, they've seen birth. And I've told some of my friends that I work with, if you have someone you love and you feel like they can support you, why not have them there? And yeah, looking back, I was like, I probably wouldn't have that many people. And there was only one extra person that was there that affected, but also the three. So who was there? My husband, my doula, Victoria, my friend, Michelle, that I attended her birth. I originally wasn't going to have her there, but when my waters were broken, I think at 2 days at this point, I just had this intuition that I wanted her at my birth to support me. And then I had another friend that I met recently, and I was like, I think she would be a supportive space. Which they were. So when Fadwa came, I think Friday night to check me, she's like, yeah, I think you need to kick everyone out. I was like, okay. I was like, you're right. Everyone needs to leave. Within 30 minutes of them leaving, I was in active labor. I was like,
My
oh my
God.
gosh, this is happening.
Did
Yeah.
something shift for you that you can tangibly like name or speak to when people left the birth space? Because what I hear you sharing is that it is people that you loved, right? And that you felt safe with and that you felt connected to. But there's
Yeah.
a really beautiful subtle layer here just in terms of the energy and the presence that anyone brings. And so I'm curious if you can name a shift in your inner experience with that.
It was a couple things. I think part of me was probably still a little scared to become a mom. You know, like now thinking of it, like in my soul, it's like, okay, I just want these people here, like they can help me out, you know. Part of it, because they were there, it feels like performance, you know. Not that I wanted to, but because people were there, it's like I had to kind of put on a performance, or just that was another part. And then just realizing it was just a beautiful space for just me and my husband to be together, and it was very intimate. And you know, two of the women that were there, my doula Vicky and my friend Michelle, ended up coming back like an hour or a couple hours after. But yeah, it was just that
And how did it
moment
feel when they re-entered the space?
it was beautiful. It was so my birth, I was a C-section baby. I wasn't able to get breastfed. I don't think my mom knew to just keep pumping and keep her milk. And in my pregnancy, I was like, I knew that I wanted women there. I knew that I wanted women to just like, I'm just getting it emotional. Just, I knew that I wanted them to just be holding my hand and just supporting. I felt like there was this sister mother wound, not intentionally. It was just imprinted in me. And so yeah, when they entered in, it was just beautiful. They just knew how to hold the space. They knew how to just, and you know, your husband's touch is awesome, but there's something about a woman's touch. It's just tender and caring, and just they knew how to like touch me and hold me and say these beautiful words. Yeah, it was a needed moment for them to leave and just be in my space and know that I could do this and be with my husband. And it was also beautiful having them back, just being there for me and holding my hand and looking me in the eye and just talking sweetness to me during this important,
That's so
huge
beautiful.
time.
Yeah.
Yeah, I love that. Like how it was supportive for them to leave, and then it was also supportive for them to come back. And
Yeah.
so do you feel as though it was like it was the clearing of your space though that allowed for the birth to really start opening?
Yeah, 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 for sure. And there were still moments when they came back, not because they were there. I think it was just me also being nervous to become a mom, that it took a little while. There was moments where I was just laying in bed and I thought I was going to be intuitive and move and dance, and I felt a lot of pressure and a lot of intensity in my back. And I remember them saying, just relax your body. In my head, I don't think I verbally said this, but I was like, I cannot. It's so hard. Like I'm trying to just relax my body, but I just felt it in my back. And I know there was a moment where I was just laying in bed. I was like, I can't move. And I think Fadwa came in at this point and said, and I don't think she would have said it to anyone. I think just we were connected. And you mentioned something about the hospital. I heard the word hospital and it was like mama mode, mama bear came in, and just like I felt this. I don't know, you could share on your perspective too, Fadwa, but I just got up. I was like, I'm ready to do whatever I need to. And it was because of the help of Fadwa, of her birth assistant, Jojo, doula Vicky, and my friend Michelle. They were just helping me and guiding me, like, okay, let's do some squats. And before, I think I would have been in my head of being so guided, but it was just beautiful to have them there and support
And
me that way.
what was it about the word hospital for you? Like, what did that bring up? What thoughts, what feelings, what stories, what ideas?
I didn't want to go there. I felt that I was nervous. I was nervous that they were just gonna be in control of everything. And I felt not in control necessarily, but that it was gonna be beautiful at home. Like I had my support team. They knew how to be there for me. And I just didn't know, like going to the hospital, is like, I've never met these people before. I don't know what was gonna happen. There was a possibility of maybe having a C-section because of having my waters broken so long. yeah, it was, and I wanted to get home. I wanted to be able to birth my baby at home.
Yeah. To me, as you're talking, it sounds like it wasn't so much a mental thing. It sounds like it was just more of an instinctual, primal response.
Mm-hmm.
Yeah, I
Yeah.
don't know if that feels accurate for you or not, but
Yeah, absolutely.
right.
Yeah, it felt like, all right, like Mama Bear.
Yeah.
Like finally Mama Bear came into the room, which I'm thankful for Fadwa that. Like I'm sure, I don't know how other mamas would react to that word, right? But for me it was like, all right, I'm gonna
I
do
feel like
this.
there's
I'm
like
gonna do
a really beautiful thing I'm seeing as you share your story, you know, when you were talking a bit earlier, you said, you know, before you had asked everyone to leave, there was this element of wanting people in the space because of the fear of transitioning into motherhood, right? And it's almost as though, correct me if I'm wrong, but what I hear you share is like that was the moment where it was like I'm stepping into it, like, you know,
Yes.
and kind of transcending that piece of fear of, oh my God, I'm, you know, I'm going to be a mom. I hit the responsibility of all of that, the unknown, you know, just, it's big and you knew it, you know, but it feels like in that moment, you chose, you stepped into it.
Yeah.
I'm becoming a
Yeah.
mother and I'm
Yeah,
ready.
I did. Yeah. There was also moments, um, this we'll maybe share a little later or so when my daughter Liberty was born, um, I felt like my understanding is like babies move with the contractions but I felt at this point she was super tired and not doing much movements. And I remember also Fad was saying like connect to your baby and I was like, why am I not? Like am I not connecting with my baby? And this was before I even knew she was going to be a girl too. Um, but the moment she even said hospital and just stepping into that, I did a lot of the work. It felt like just like pushing and just really being a mother and preparing. I feel like birth also prepares for that integration or the possibility, like an opportunity to integrate that. I was like, wow, I can do this. I got up, I was able to move and push and like I'm capable. Yeah, it's really beautiful to reflect back and have these questions, just like, wow.
Mm. Yeah,
So
absolutely.
what happened next?
Yeah, so she mentioned the hospital. We got up. I remember we had the rebozo and we're doing the squats and we're moving and doing all these different positions and I get into the water and well actually there was a moment because you asked me like why I didn't want to go to the hospital and I was thinking like things like I was okay with doing. So because my waters were ruptured, I believe Fad will correct me if I'm wrong, the Liberty's heart rate was starting to increase at some point, and they were worried that there might have been an infection. So she offered antibiotics, which normally I wouldn't. I'd be like, no antibiotics. But I was like, you know what?
And at what point in your labor is this? What day are we talking now?
This was the middle of the night, Saturday. I think it must have been maybe 2 a.m. or 3 a.m.
Okay. And the reason
So I
for
was,
the reason for concern of infection was you did have some fetal monitoring during your labor and your daughter's heart rate was elevating a little bit.
yeah. And Fadwa
Okay.
did one cervical check, I believe Friday, before everyone left. So it must have been like 9-10 p.m.
And
So I was 12
Fadwa?
hours away from.
Okay. And Fadwa, what was the reason for that cervical check?
I'm looking back in the notes and I do not see that we actually did a check. We did
You
not do a
didn't?
check.
Okay. Maybe you asked me
Mhm.
then.
We didn't do a
So
check.
maybe
The
you just did it
first
when I was like,
check,
okay.
the first
We're being
actual
really
cervical
specific
check
with our
was
Okay.
done on the 29th. So it was 4 days later and in the afternoon, and she was a 2. She was 2 and 80. So
But
good
you
thing
did a
we didn't
cervical
check
check.
sooner. Did
So
a
4
cervical check
days
that day.
into
So yeah, 4
labor,
days.
we started
Yeah.
on the 25th,
3.5.
day 29, 3.5 days
Yeah.
in, the first
Okay.
check happened, and we were sitting at 2 centimeters.
We were still super early, which is what we, had been assuming. The
And so
next
what was
time
your
I
process
checked,
at that point? Like, what is your thought process at that point, Fadwa? 3.5 days into the birthing process, waters are open, checking her, she's 2 centimeters.
her blood pressures are good. The baby's heart tones were good. Baby was moving. Karina had energy. She could eat, she could drink, she could rest.
Right. And you said that
Why?
she was
Why?
checking her temperature.
She's checking her temperature and she's
Right.
able to
Okay.
get sleep. Like a lot of moms in this situation get dehydrated because they can't keep anything down, or they get to where they can't pee and they get a distended bladder. Like there's various things that can happen to a woman in a long labor, and you want to monitor for all of those things so that you have the best case scenario. And
And
whether
so,
that best case scenario is at home or at the hospital, it doesn't kind of matter at this point. We'll stay home as long as we possibly can and still have a good outcome.
and so
So in the
for,
hospital, oh, sorry.
I was just going to ask actually you and Fadwa both as birth keepers and midwives, have you seen and been present for a labor like this where it's quite long, the waters are open for a while, the contractions are kind of like, here, there, a little bit, and it's not moving super, super quickly? And like, have either of you been present with a labor like that prior to,
I
or
have
Sam at
not, but
all?
I'm much less experienced than
Right.
Fadwa. I haven't had any births go even over 2 days. I haven't seen
Okay.
a long labor.
Okay.
I wish that only we would see births where we see birth, and we just don't. We have sometimes it feels like there's seasons where we have these long labors, and maybe the waters are ruptured, maybe they're not ruptured, but women are having contractions that they're experiencing as painful. They're having issues with not being able to rest, not being able to stay hydrated or stay nourished. And they get to a point where they become exhausted. And that exhaustion is really what prevents to be able to keep going at home.
Right.
Um,
And that's a good point to make as well. As you're talking about exhaustion, I remember one of the OBs speaking to me and saying the uterus is a muscle. And just like the rest of the body, it needs time to relax, but it can't go on indefinitely, right?
So that's the thing. And we really, I don't know if we do a good enough job, even like we're still, evaluating our process and how do we communicate with clients from the beginning and throughout the process that this is a potential reality. And it's not what anybody wants, but here are the ways that we know that you can try to prevent exhaustion. Pretend it's not labor as long as you possibly can. If you're asking yourself the question, am I in labor? The answer is no. Because once you're in labor, there is no question. You're telling me that you're in labor. And that's something that's kind of like hard to really drive home, because at the first sign of some different feeling in their body, it's like, is this labor? This is labor? And no, labor is a whole process that can take days, even weeks. It's the whole pregnancy practically is preparing your body to that point where your uterus is able to release your baby into the world. And it's a dance with your uterus and the cervix and the muscles and the vagina and all of that. And
And the
you you
mind,
you you,
right?
you have a lead in time.
And
So much the mind.
Hmm.
so much the
Yeah,
mind, right? And
so
that's
much the
exactly
mind.
like what you're
So
speaking to there is like a golden nugget, I feel like, as a birth worker. It's definitely
Hmm.
something that I encourage all of my clients to do, is like pretend it's not happening until you can't anymore, like until it takes you. Because once it starts to take you, the mind is so involved, and this, like, your spiritual, like, there's just so much of your consciousness, the entirety of it, really, that's involved in the process of birthing. And so, when you talk about exhaustion, it's like, if we can avoid mental exhaustion, the body will stay stronger for much longer. And so, like, yeah, I
Hmm.
think of even my mom's birth story with me. She like baked cookies and was watching my cousins and, just like going about life until she was bent over the counter and like couldn't anymore. She couldn't ignore it. And so I think, yeah, that's just a really beautiful piece of wisdom that I want to even echo further. And for anyone listening, woman, birth
Right.
worker, is like, just go about life and be in life as much as you can until like birth will take you. It's a portal, it's an energy. It's like you get sucked into it eventually. There's no choice about
Mhm.
it.
Well, and that piece as well of just like our bodies during the entirety of our pregnancy, like Fadwa, you were talking about, like we're kind of in labor the whole pregnancy, we're always constantly preparing for this emergence, and our bodies are doing that in different ways. But my whole pregnancy with Floyd, I had cramps. Like I was like, is this normal? Is this okay? And every professional I spoke to was like, yeah, that's fine. And so when I started labor, it just felt like that. I was like, well, I've had cramps this whole time. So, my uterus is just constantly being prepared and stretching and expanding and welcoming this being.
I wanted to share a little
Right.
bit
Well, and it's true, right?
because
Because we
I
know that the body. Oh, yeah, go ahead.
yeah, no, I just wanted to share a little bit of like why I wasn't exhausted, and I intuitively just thinking I'm so thankful for my husband, and he's seen me like leave home to support mamas, and I've always told him like make sure that after every contraction like I'm hydrated, and he like kept me very hydrated. I had a lot of coconut water and a lot of um watermelon juice, and even when our Jula and our friend were over, we just were watching some movies. So it was very relaxed. And yeah,
Hmm.
I feel like mentally I wasn't exhausted. Physically I wasn't exhausted. So
Were you
Hmm.
thinking about it a lot? Like where was your mind going in those moments? Yeah, what was your mental process? Do you remember?
was I thinking about it a lot? There was moments where I questioned like what is happening? Like why aren't they starting? And I remember even asking Fadwa, or maybe my husband asked her, like, do you know what's going on? She's like, I have no idea. I'm like, okay. Um, I
I
think for
love
me,
that.
it was like mentally of like, all right, let me just trust. I was just trusting. Like, I was also tuning into my body, like, everything feels good. My baby feels good. But it was just a lot of trust.
Hmm.
I
And
think
so
that's
then
really
you're,
beautiful to highlight.
yeah, yeah, that trust piece. And
Right. I'm very fascinated about that psychological component, right? To really like weave that into our conversations of like what is happening in the psyche, like, and that the energy of trust, right? So how does trust influence the process versus fear?
yeah, and I'm curious where that trust was directed. Was it directed to you, to birth? Was trust being directed to your baby, to your birth team? Was it, can you describe that a little bit?
Yeah. Well, like just my learning more about birth and attending births, I did a lot of inner work as well beforehand and even during my pregnancy. And um, yeah, I was trusting in my body that my body was able to do what it was going to do and needed to do, and I was capable. I think even one of my signs said like I'll have to like look back at it, but it was like I trust my body, I trust my baby, I trust the mama bear I'm becoming. Um, it was a trust in, yeah, in my husband and my friend that was there and my doula. I have also done sweat lodges with her before, and a lot of friends have also used her as a doula, and I've just known her and gotten to know her better. And it was like a friend. Like just having her at my house, we were just laughing and giggling, and just also knowing that she trusted in the process.
So
Uh,
I hear you describing that her presence was eliciting a sense of safety for you.
yeah, absolutely. Yeah. Yeah, there was lots of safety and being seen, and even just thought was saying, I don't know, but being in there with me, being uh yeah, just capable and wanting to. And
That's so interesting,
Sorry
you know,
about
because
that.
on the last episode, I'm sure you remember, I was talking about how a care provider actually acknowledging when and where they don't know, and
yes.
how that can elicit a sense of safety.
The
Mhm.
sacred, I don't know.
The
Yeah.
sacred, I don't know. And
The
so I'm
medicine of
curious, like that's
humility.
really right. And it's the very next episode recording, and you're basically describing that process. You know, you just said, even though she said, I don't know, that I didn't know that we were in it together.
Yeah.
Mhm.
I was sharing Fadwa that at some point either me or Joey asked, like, what's going on, like, with our waters having been broken, or my waters being broken so long. You're like, I don't know. We're like, okay. Like, but you're just your spirit and willingness to just like, okay, we're gonna take it day by day and or moment by moment. And that just felt really, really good and safe. Yeah.
Authentic,
Yeah,
Yeah.
it's
real.
really served me well for all these years to just have a really basic um, understanding that you always go back to the basics. I also have a background as an ER nurse, and you know, saving lives supposedly. You know, people come in needing resuscitation, and it was really poignant to me that it was brought up. Like I was all nervous about this person coming in having a heart attack, and they're like, "Dude, they're already dead. The best we can do is bring them back to life. And if we do that, yes, we've won, you know, but if not, it's like they're dead. Like they died already. So we're not dealing with that so much in birth, but going back to the basics of mother's vital signs, fetal heart tones, what's the story? You know, sometimes we go outside of the range of what is perceived as normal, which is also so constrictive in the hospital world, the general world, in terms of what we know birth can be and all of the things we don't know birth can be. As you mentioned in the episode I was listening to, so much data that we have no access to for people who are unobserved. And, you know, so what we know, all the only things we know are really these births that have been observed and births that have been observed in the hospital for the most part. So, you know, bottom line, if you've got a healthy baby and a healthy mom, you know her history as being you know, having a good lifestyle and eating healthy food. She's not a diabetic. She doesn't have high blood pressure. Like all of these things, you have room to step outside the lines a little bit. You have room for someone to have their membranes ruptured for a longer period of time. You have room to go past 42 weeks if that's what's happening, and still be okay as long as you're looking at the basics and the basics are telling you that everything's okay.
And what I love as you're talking and describing your story, Fadwa, is that you are like, you're a midwife that is leaning towards home birth and supporting those sorts of women, and yet you still pull on that experience and that wisdom from time in the hospital, and you're not throwing the baby out with the bathwater, I guess, for lack of a better example or phrasing, right? And yeah, I mean, I love hearing you talk, and I love that you're pulling from all these different areas and you're able to honor, you know, your experiences within the medical system and still see value in that.
Right. My question for you to come on with that thread is, you know, so correct me if I'm wrong. My understanding is that you were working in your early time in your career as a nurse midwife, and you were working in a clinic setting, a clinical setting instead of a home setting. Is that correct?
Clinic and hospital, birthing in the
Okay.
hospital,
And so
working
my
in the office.
right. And so my question is, you were describing, you know, this process around Karina's birth. Um, you know, you had been monitoring certain things, and you know, the baby, her, you know, different elements that we've described and discussed about. And then you were determining that because there was no signs of risk or concern that were presenting, that she was good to continue laboring, even though 4 days, 3.5 days in, we were at 2 centimeters. would the process have been the same in the hospital? And if not, what would be different? Like, I assume they would be monitoring the same things, but would they, in seeing no immediate signs of concern, would they give the same amount of space to just allow things to unfold, or would they be
Probably not.
pursuing?
Probably not.
Okay, so what would be different
One of
and
the
why?
things you have to understand about the hospital, Neil Shah, S-H-A-H, S-H-A-H. He's a pretty cool writer. He's an MFM, and he wrote this book about healthcare. I can't think of the name of it off the top of my head, but he describes labor and delivery as a pressure cooker system. And this is why. This is why Pitocin is so prevalent. It's because, they only have so many beds, and the women come in and they got to get them birthed so they can move them on to the next area so the next woman can have that bed. And they can't tolerate 4 or 5 day labors. They just can't. And they're going to be checking tons of checks, and this person is inevitably going to get chorioamnitis. And then the temperature goes up, and then they give the antibiotics, and then they do the C-section because the temperature's up and she's not close to actually having her baby. It's just a cascade of interventions that are dictated by the location and the fact that they need the beds. They just don't have the time to honor birth the way that birth requires.
Do you feel like most people in the system are aware of that element in terms of the fact that there's not enough beds and they need to rush people through it? Like, are they, do you find people in the system cognitive of that element, or are they excusing the behavior and the rushing and the intervention because there's actual risk, right? Like, what is the teaching here that
Yeah.
they're following, and what are they aware of?
I
Would
think
you
that
say?
there's a combination of things going on. I think most of the nurses are just following the rules, and that they believe these rules are there for a reason, for safety, and some people may be aware that it's not really a risk, but they wouldn't necessarily acknowledge it. I think there's a few midwives or doctors who have seen enough to actually have that understanding, but most of them, they just have this attitude that every home birth is a train wreck because the only ones they see are the transfers in. Every free birth is a disaster because the only ones they see are the ones that have transferred into the hospital. And so
Exactly.
they're skewed. It's like they just don't know,
Exactly.
and they don't seem to care that
Right.
they only know that. They don't care that that's just a part of the story.
Fadwa, could you speak a little bit
Right.
more on the
So
difference between
I
Pitocin and
also want to just,
oxytocin? Because when
I think we have a
Go
little bit
ahead.
of a lag, sorry. So yeah, my sister used to be a labor and delivery nurse. And when she was working in the system, one story I remember her telling was of a doctor who came out of a birthing room and things weren't progressing at the pace that he wished that they were. And he made a direct comment of, we need to get this baby out. I need to pick my child up by 5 p.m. And so I'm curious as well, like, have you seen that dynamic in practitioners in the system where, like, really there's not really so much of their consciousness that is even oriented towards really honoring birth? Like because when I hear a semantic like that, it really, like, what I receive in that is, oh, this person does not at all care about the work that they're doing. Like, how could you want to rush birth so that you could pick up your child from whatever activity? Right. And so I'm curious
Yeah.
if you've seen that dynamic. Is that something that's
I
prevalent in the
mean,
system?
people are people, right? And some
Right.
people love their job, and others, it's just a job. And I think that that's really what you're going to find. And unfortunately, labor and delivery is no different. It should be. Like, there should be some extra layer of compassion and humanity that you have to, like, take a test and qualify to work in that area. But unfortunately, it's not like that. And you see, like, if you canvass any labor and delivery unit, the C-sections are highest around 5 p.m. and again around like 10 at night, and again around at maybe 6 in the morning. It's like all those times where shift is changing, or somebody wants to go to bed and not have to get woke up in the night, and different things like that. And they're humans, right? They're humans, and they have families that they do care about, and they find it different to extend that care to this woman laying in the bed that they've never met before, because she's not their family, So not everybody is like that, and we have to remind ourselves that, the nurses and doctors in labor and delivery don't get up in the morning and go to work hoping that they can fuck up somebody's day. They
Right.
probably want to do good work at the end of the day, but they also you have the hospital like culture, and you have the systems that are in place, and everybody has to stay in their lane, and things like that. So it's not the place for birth is really what it comes down to. And we're so happy it's there when we have circumstances where a woman or a baby need the surgery and the drugs and the care that can be given in the hospital. Like we can't, we would never want to get rid of it, but we need to take normal birth out of there. And normal birth, needs to be cared for somewhere where there's people who want to be there and want to honor this process and believe in the spirituality and the crucial nature of the fact that you are born once in this life, one time. And the mother gives birth maybe a handful of times, but every single time it's critical. It's a life process. It's a shift. It's an opening. It's a gathering unto. And you all know like how special it is, and it needs to be honored that way, like every single time.
Yeah.
So, and then we get
I'm
into these
curious.
situations where we have women whose water is broken for 5 days, and we're doing everything we can to try to like honor that and keep her at home and have a live baby at the end of the day, like that's the thing. So I feel like at some point it was when you were starting to get active, but I think we looked at the calendar and it was like, it's been 4 days. I think we should do antibiotics. Like, let's give you some fluids and do some antibiotics. Like, I feel like the negative side of that is overcome by the positive, where we could maybe keep this mom from having an infection and help the baby not have an infection. And don't have a crystal ball, but I just don't think it can hurt. So I feel like
Could
that was
you
Which
the
I just want to
positive.
highlight the reality of the beauty of your scope of practice, right, in this specific birth. Because for me, I'm not a nurse midwife and I'm not walking the medical path. And so those actually aren't skills that I would be able to bring into a birth space, right? And so to just also speak to, we very much so are navigating this spectrum of wisdom that birth keepers and midwives carry, and how those skills benefit different birth spaces. And so I think, yeah,
right?
just to
And I'm
celebrate that you were able to offer the care that you did.
And I'm curious to know as well, if either of you could speak to the difference between Pitocin and oxytocin, because I know that you mentioned that. And when I was admitted to the hospital, they were trying to pump me with Pitocin. Um, and I said, I don't want Pitocin. No, they said, we are encouraging to administer oxytocin. And I said, I don't want Pitocin. And they said, don't worry, it's the same thing. Oxytocin, Pitocin, they're synonymous with each other. And that went against everything that I understood. And so I'm curious to know if maybe I was incorrect, misled, miseducated, or if the doctors were correct, or maybe if there's some gray zone that, because
Yeah,
I still don't have an answer here.
it's a gray zone. And they
Okay.
were using semantics to
Okay.
get you to agree. So it's true that Pitocin and oxytocin in a bottle are the same thing. Pitocin is like the brand name, and oxytocin is the drug. But it's
Okay.
synthetic. It's still synthetic. It still comes in a bottle. your body makes oxytocin, which is in endogenous oxytocin. This is exogenous oxytocin. And so it will work similarly, but I believe that if you're if the exogenous oxytocin that you get through the IV, if they lock onto the oxytocin receptors in your body, they're there. And your endogenous oxytocin just sort of stops, it's not needed anymore. So your body doesn't produce it like it was. It's similar to what happens with when you get an epidural. So you've been laboring at home and you have this whole cocktail of hormones. Michelle Odant talks about the cocktail of hormones, which is not only oxytocin, but endorphins and serotonin and maybe cortisol. And your body makes all of these hormones as it promotes your labor. It actually helps the baby be ready to be born. And then you get an epidural, which kind of like sort of cuts you off. Now your brain is not involved in what your body is doing. You can't feel it anymore. And that cocktail of hormones just sort of fades away. So you no longer have it.
Are we
And
talking like your rational brain or your like limbic brain? Like which part of the brain are you
the
disconnected
whole,
from?
like wherever it comes from,
Okay.
you
Okay.
disconnect like at the level where you no longer can feel. Somewhere mid body, just above your uterus. And you literally disconnect. Now you're disconnected from your baby. And the baby
Mhm.
feels it. And the baby's like,
Right.
Right.
wow, where did you go? Like, I'm in
Right.
this is still happening, but where are you? You know? And
Right.
so that, completes like that. Now, I am not anti-epidural. I feel like I've seen so many cases with an exhausted mom who wasn't able to get her baby out at home, goes to the hospital, gets an epidural, gets some Pitocin, and pushes her baby out. And at that point, we're like, that's a win. We
Totally.
had a
Yeah.
live baby, we had a vaginal baby. Like, it
Totally.
was amazing. We couldn't do that for
Right.
you at home. We didn't
Right.
have what we needed to make that happen
Yeah.
at home.
And so
So,
I'm wondering if you know where the Pitocin comes from. You said it's synthetic. Like where's the base material sourced, if you know?
so I don't know for sure. If my guess is that it's synthesized in a lab, much like synthetic vitamins are produced. It's like some chemist puts the molecules together in the right way, and you have
Right.
oxytocin.
Okay.
Right.
Okay.
What's really interesting to me, the point I want to highlight in what you just shared, was when you shared the point around once we start in offering Pitocin, the receptors are full with that external oxytocin that's being delivered through Pitocin. And so the body stops producing the oxytocin. But what we know is that oxytocin is relevant to more than the driving of the contractions of the uterus in birth, and especially in those moments post-birth. And so I feel really curious around the impact actually in the golden hour when a woman has been given external Pitocin and thus her own production of oxytocin has either been slowed or stopped. Because what we know is that we also have really big rushes of oxytocin produced naturally as the mother is receiving her baby skin to skin in those first moments of breastfeeding and suckling. And so I'm curious if that production of oxytocin is impacted by the Pitocin and thus actually the bonding and connecting in that
Yeah,
golden hour
I would
time.
really love to know, like, to see someone do a study where you maybe take blood samples from the mom. Can you tell a difference between endogenous oxytocin and oxytocin that's been given, artificially? And, they also put a pretty good sized dose of Pitocin in that liter of fluids that are hanging after you give birth. Almost everybody gets Pitocin in some form or another, either through the IV or IM post birth to make sure that their uterus cramps
That they don't
down.
bleed. Right,
So they're
exactly.
also
And to avoid
getting that
hemorrhage, right?
yeah, it's for anti-hemorrhage. And so they're also getting
Exactly.
that in that first hour. And is it the same in terms of how the mom feels about the
Right.
baby? I don't, it would be an
Right.
interesting
That is such an
study.
And our
interesting layer.
conversation yesterday or last week was all about informed consent. Like how many women are receiving Pitocin and not consenting to that fully, you know? Interesting.
Right.
And you know,
Well,
speaking about, sorry, go ahead.
no, go ahead. No, no,
I
no,
was
you go
just going
ahead.
to say, speaking to the golden hour, I've heard of women, they've shared their stories with me, and they birth their baby that is still, but they birth their baby at home and they have that golden hour. And they don't describe their birth as traumatic. They describe it as sad, as heartbreaking, as the worst thing in the world, but not traumatic because they still get that time with their baby. They still have that golden hour. They still have all of that oxytocin that's being pumped through their body that they created. And I feel like that's a really big difference in like my story as an example, where I had all that oxytocin that I was being pumped through and all of this kind of stuff. And then, I got to hold Floyd, but then I woke up from a coma and there was a cascade of other things that interrupted in order to save my life. I appreciate that interruption. However, I've heard of so many women's stories and some of them end in death and they still got to have that golden hour and there was still that integration time because I think that what you're speaking to there where we have that oxytocin that our bodies are producing and creating and then we birth our babies and we get to have that time whether it's cuddling or nursing or whatever it might be that golden halo of an hour to 3 hours and that immediacy of postpartum we can
Were
still have
these
that
situations that were not attended by some type of a provider?
Some of them were attended, some of them weren't. In some cases, the baby took like a breath and then stopped breathing right after birth. In some cases, the baby had passed away during labor or a couple days before. They were all various circumstances. I've heard so many
Yeah,
stories.
because it just feels like in my world, like we have to call 911. I mean, the family can decline that,
Hmm.
but I
Yeah.
can't. Yeah.
And in some cases, like they did call 911. And then in another case, there was a woman who she knew that her baby had passed away, and so there was no need, according to her birth provider. I think it might have been a birth keeper out of the system who was like, "Hey, I'm going to attend your birth," and we there's no need to call 911 in this case. I think, yeah. But each story is so unique, right?
So unique, and there's also, I mean, there is certain risk, like what Fadwa was
Yeah.
speaking to there in terms of like there is a certain like liability to call 911. So, I feel like in a dynamic where it was known that the baby had passed ahead of time, everyone can be in agreement, right? Then we have, the story of like Gloria Lamee right now that's going on, and the parents were aware that there was a risk that there was a breech baby and sought that care, and then in whatever she did or didn't do in the birth space, they still pursued pressing charges when the baby passed away. And so, like it's such a delicate thing that it's a really tricky area.
And that's where having a rapport on both ends, right? Like the family needs to feel safe and trust in their birth care providers, and the birth care providers, no matter who they are, also need to have trust and faith in the family that they're serving, right? It goes both ways. It's not a one-way street, just like any relationship. Yeah. Yeah.
I would love to pivot back to Karina, and maybe we can
Yeah.
finish the birth story and hear how your daughter entered the world.
Yeah. Yeah, I was actually curious about because like I said, Fadwa and I have this relationship. We knew each other way before I even got pregnant, and I may have asked her before, but like I don't know. I don't know if it's because of our relationship she chose to also trust and support me, like trust in my trusting and support me in that. So yeah, I don't know if Fadwa
Yeah, I
would you
think,
have supported someone else?
I
I don't
mean,
know.
it depends on how close I felt with them, but you guys, we checked in multiple times. I came over, we talked, looked at the situation, listened to the baby. You seemed in good spirits. You didn't seem hesitant. You seemed like this is what you wanted, and you were okay with me not being there in the early phases, which is really, really hard to do as a midwife, to like be there for 36, 40 hours, whatever. Like it becomes not productive, really. And the part that you really needed me for, like starting an IV for you and really getting you across the finish line, because it was a lot of work to get her out, even though she was like a little peanut, you really had to work hard. So, so it was great that you were in somewhat independent, and you had your helpers, you had your husband, you had your doula and your good friend, and you guys were doing great. And so those were all pieces of the puzzle, and it didn't hurt that I had known you for a while and that I considered you a friend. So that was helppful too. I've done this.
Appreciate you.
You're not the only person that I've gone 4 days of ruptured membranes with. So, we was with a group of midwives yesterday. We were kind of jokingly saying, like, let's have a risk contest, like over maybe a little bit of alcohol even, and just see, what's the
Could we record
scenario.
that?
No way. But I seem to be the one that gets, people come that have like, I mean, you just start, it's a laundry list of risks, and you got to sit down and you got to just really go through it and say, I just hope you understand this is the scenario we're dealing with. And in the regular world, like, we would all be put in the loony bin or worse, but you seem like a good candidate. You seem very, very motivated. You seem to understand all of these risks. So, okay, I will walk with you as long as everything still looks good. So,
Yeah, I wanted to ask that because when Sam posted your story, and I was like, I want to share my story, and I just knew, like, having my waters broken for 5 days, I wanted to share the story for other mamas to hear, and just like the options and possibilities. And so yeah, I feel like it was super helpful for me just knowing a little bit about birth already, and trusting, and being able to hold the space for other mamas. So, but yeah, back to my birth. Where was I? I was mama bear. Yeah, so there's so much. I wish I could just like be here for hours with y'all, and because there's so much of what you've shared in your previous podcast too, of kind of having these intuitions or fears of, it wasn't about my baby dying, but it was about me dying. But there was a moment of like, oh my gosh, like I have to push through. I have to like get her out. So yeah, so I had my doula, my husband, and my friend like helped me out with the rebozo and the moves, and even Fadwa and Jojo were helping me like with certain like the spinning babies moves. And I think at some point Fadwa realized I had the cervical, like baby was behind the cervical lip, and she helped with that. So yeah, I went into the pool at some point.
Can you
And
describe what that means, just for the listeners? Having a baby just tucked in behind the cervical lip?
I mean, I'm sure Fadwa can explain it way better than me, but I know that she went in there and did something to. So, can you explain that, Fadwa?
so it's really common. It's always, as if a mom is laying on her back, it seems like it's always in the upper right corner of the vagina, where you feel around behind. You don't feel any cervix in the back, and then you feel this like, this bit of cervix that's kind of like hanging over the front of the baby's head, that sometimes you can put two fingers into it and just push it over the baby's head as the mom is pushing down, and then it disappears behind the baby's head, and then you can call the person completely dilated. It can happen, and it can be manipulated earlier or later. It just really depends. I mean, some people start trying to do this at like even 8 centimeters. I find that you don't have so much luck with it and it's really uncomfortable for the mom. If you can still feel cervix way in the back, then you need to just wait. And often the body just resolves it on its own, you know. But if you do have someone who's been hanging around and progressing really slowly, and situations like this, it's not that uncommon that you then find it when you do an exam. And when you do, if they're open to it, I call it directed pushing. They're on their back. It's very similar to what it looks like in the hospital. And you're holding the cervix back while they're bearing down. And ultimately you feel it sort of just boom back there. And then it doesn't show up anymore. And then they're fully dilated. And at that point, I invite them to get into whatever position they want to get into. If they want to get back in the tub, some people it feels good to have that direction and the fingers down there showing, do you feel this? This is where you should be pushing. You know, by then they're kind of tired and they just want you to help them. They're like, just pull the baby out. Oh, you can't do that. You got to push your baby out. You got back in the tub and burst in the tub? Were you rebozoing in the tub, like door squatting in the tub?
Yeah, I think Joey had the rebozo and his neck, and I was squatting a little bit, and then I was doing the lunges. And yeah, I definitely, I never had that urge to push, so I really had to, like, just with all my my might and strength. And um yeah, and so yeah, I started feeling her, um and I knew that I wanted just to hold her head, just to be able to, like, that felt good to me. And from what I remember, like, hearing the video because someone recorded it, uh her head came out and her body came out, like, just right away. um where I thought it was her head was going to be out for a little bit, and no, it was, yeah, came out right away. And
And she was fully in the water.
she was fully in the water. She was in the water for a little bit, so her cord was wrapped around her neck 3 times. And from what I remember, like, her cord was pretty white. Like, just when I've seen other babies be born, it was very juicy and like colorful. Hers seemed fairly white and thin. So when she came out, she was there, but it took some support for her to, like, take her breath and come to life. So thankfully, a month before, I took a neonatal resuscitation course at Fadwa's office, which I'm so thankful for, it because it allowed me to we practice these scenarios, like, what would happen if baby needs some support? Like, baby does not have to leave your side. You can hold baby. And that's what happened. I held her and Fadwa came in, and so I sucked some stuff out of her nose, but she had so much in there that Fadwa used something to take some of that mucus and stuff out. So yeah, she was using the what would you
Bag and
call it?
mask.
Bag and mask. But
To
I
give
had her
breath.
there with me. And are you from any of you familiar with Barbara Harper? I would suggest to look her up. She's this, like, water birth, beautiful, like, teacher, but she was there at the class and she was in my group. And at one point, like, in the class, so I was holding baby and she's like, talk to your baby. And I was like, why wouldn't, so, like, I just remember talking to my baby, talking to Liberty when she was, because of Barbara, because we practiced it. And I remember my husband was calm because I was calm. So I was just talking to her, like, you came here for a reason. I was breathing on her. Fadwa was, doing
The breath.
the bag and mask, but I was there with her. I could hold her, and then she took her cry, I think, like a minute or 2 minutes later. I'm not sure. But for a moment, I was like, I had to process that too, because I even asked Fadwa, I was like, could there have been a moment I took it too far? Like, and I felt very in between worlds. And yeah, I'm, like, emotional. Just a brief little story. So she was born at 10 a.m. and my sister, she's my half sister. We have the same dad. Later on, I noticed she texted me at 10:03 and she said, hey, I had a dream with our dad. And my dad passed away in 2016. I had a dream. He was holding a little girl's hand, again, before we found out it was a girl. He had her next to a window. It was super bright, but my sister's like, she wants to stay. So like my sister takes my daughter. So like, I don't know, like could have it been an in-between world, a possibility, but she chose, to be here with us. So yeah, we held her, and I know that the placenta takes a while to release, but there was some intuition happening. I was like, why isn't it coming? So I decided or they guided me to squat. And as soon as I squatted, I was like so dizzy. I had ringing in my ears. So in the initial video, when my daughter was born, Fadwa was like, oh, that's a lot of blood. So they helped me get out of the tub. Actually, another midwife showed up 30 minutes before I gave birth, Lauren, and she worked with Fadwa, left, and I always knew that I also wanted her as my midwife. And she was visiting that weekend. And Fadwa was like, oh, initially she said her other midwife, Phoebe. And it turns out Lauren shows up, and I'm like, I can't say anything. I see her from the corner of my eye, another angel. She was the first one to hold my baby because my husband was running around and I could not hold her. I was scared because I was so dizzy. This angel comes in and holds my baby. And from what I remember too, what my husband told me, like Fadwa had to go in and grab the placenta because I was just so dizzy and just not feeling well. Yeah, so I remember I was on the floor. Lauren had my baby. I think there was another IV that you put in. But as all this was happening, again, sorry, this is like my first time sharing this like portion.
You're doing so great.
Thank you. It was a lot, and I had to process a lot because I was like, wow. Okay, when I got on the tub before the placenta came out, I told you I had this fear of me dying, and I was like, oh my gosh, is this it? Like, am I gonna die? So I actually had to take a deep breath. I was like, okay, Karina, you're strong. Like, you're gonna be here. Breathe. And they took care of me. Like, everyone just was there taking care of me and present. I walked to the other room. Actually, I walked into this room. So I gave birth in the next room, and I came into this room.
Okay, wait. So is the cord still attached to baby?
Yes.
Okay.
Yes. Cord was attached for 2 hours, 3 hours. Yeah. Yeah, so we moved into here, and actually my friend Michelle, my dear friend Michelle, she was the next person to hold my baby because my husband was like running around. So she did skin to skin with my baby, and I was next to her just because I was just so tired and exhausted. At some point, I think, yeah, Fadwa wanted me to go to the hospital to get a blood transfusion. Is that what it's called?
Probably.
So funny because your episodes, like, right on. I was like concerned. I didn't want someone else's blood because I didn't know if they were vaccinated. I don't think I told you, Fadwa, but I was like, told my husband, I was like, I don't know if I want someone else's blood. I was like, I think I just need a rest. I need a lot of food.
Isn't that the weirdest thing? Like the thoughts that come up for us? Like, please don't have
Right.
vaccinated blood.
Seriously,
I was
yeah.
like, I don't know. I don't want anyone else's blood.
I'm glad
So
I'm not the
I
only
ended up
one who had that thought.
No, I was like, I need to tell her. I was like, this me too. So yeah, I was exhausted. I didn't breastfeed for a little bit. But also my daughter Liberty, she was just out. She was sleeping and tired as well. So we were both just needed to relax and sleep. But yeah, she's here. She made it. And I feel like all of that was just part of my story to share. Like the next day as I was processing, like, I want to share this. I want to share this story with the world, with mamas. There's so many different stories and so many different possibilities. Yeah.
Amazing.
Yeah, and I'm here. I'm here getting the opportunity.
I want to just add in the medical stuff, all of that, if since I'm here. So yeah, we found her to be completely dilated at 8:25 in the morning, and this is on the 30th. So this is the 5th day that she was ruptured. By then, we had given already a dose of the IV antibiotics because we were having this rising baseline with the baby, and we really got her heart tones back down into like 150s, 160s, and then towards the end, she was back up into the 170s, but like 130s to 170s. So she wasn't just like hanging out tachycardic. So we were okay with that. Um, her APGARs were 5 and 8. So I don't know if you know much about APGAR, but 5 is a pretty low APGAR. So she had pretty low tone. She
And APGAR
had
is
the APGAR is the they assign an APGAR at 1 minute and 5 minutes of birth. It's not intended to be a guide of whether or not you resuscitate. It's actually it it can predict neurological, like long-term neurological health or not, based
so
on
this is a test that is done?
it's looking at 5 different things on the baby. Are they, what's the heart rate? Is it over 100 or under 100? So it's a 0, 1, or 2. Respiratory effort, strong cry, weak cry, or no cry, 0, 1, or 2 also. Reflex stimuli, are they grimacing when you put something in their face, or are they just blank, or are they coughing? Cough, it gets a 2. Muscle tone, they're either well flexed, they've got some flexion, or they're completely limp. And so, and their color is either white, or they can be pink with blue extremities, or they can be fully pink. So everything's a 0, 1, or 2.
So
And
what if the baby is born and they're gray?
it would be a 0. I mean, they would get a 0. If there's no tone, no grimace, no heartbeat, no, it's all 0.
Yeah.
It's a 0.
Okay.
So the lowest you can have is 0. The highest you can have is 10. And so this baby was a 5. We feel for heart tones right away. Her heart tones were over 100. That's probably the most reassuring aspect of everything, is the heart tones. So heart tones over 100, but the rest of it, she was kind of like gave a little cry by a minute. She was making a little bit of face. She had some flexion, but she was pale. She was pale, and so there may have been an abruption at the very, very end. We don't know exactly, but whatever it was, she came out in the right timing, obviously, because she's here. So, and then we did the suctioning. We gave her some breaths, and she perked up with that. And we gave her 5-minute APGAR was at 8. I think she was still off with her flexion, and her crying still wasn't that great. She wasn't really giving us a good cry. We don't do the same thing like in the hospital. I worked there for so long. The nurses will get those flannel blankets and they rub on the baby's back really vigorously. And those babies are giving a cry of pain. You hear them, it's pain, not just like, I'm going to breathe, it's crying. They are in pain. And so we don't do that at home. We do a little stimulation. I usually use my hand. It's not rough like the blanket. It's going to be soft. It's going to be skin and wet and sliding over the vernix. I might rub the bottom of their feet. I don't do any kind of strong pinching or anything. I'm not trying to hurt a baby. We want to stimulate them. And there's ways to stimulate a baby without hurting a baby. So we were
And so
doing stimulation.
what it sounds like is that you weren't concerned, even though, the baby was, not fully animated upon
So
birth.
we're concerned enough to be doing not just here's your baby. So we're doing postural drainage, trying to help the baby get rid of the mucus, do a little
Hmm.
suction to try to get that out. Also, it's irritating. They don't like it, so it makes them cough sometimes, and that coughing is also beneficial to them. And then
Hmm.
when she still wasn't really showing us that she was trying to take that big birth cry, we gave her some breaths to open her lungs. Her heart is beating. The best thing we can do at that point is to help move the oxygen through her body so that she gets what she wants. Eventually, she's going to take over. We know that. And then if she doesn't, then that's a whole nother story. But so we're just supporting her in those moments of initial transition,
And
if you will.
all the while baby's still on mom.
Still on mom, very close to mom, like that. Then the placenta was out within a half an hour, but she had a lot of bleeding, and in that we really wanted to get the placenta out. But we leave baby and placenta attached for hours, typically until we're going to do the newborn exam. So if there is
And so did
any
you
type
manually
of
remove her
I
placenta?
didn't manually remove the placenta. We just got her up into a squat and encouraged her to birth it. And it actually, you know how most
Okay, great.
placentas come out with the shiny side? Hers came out
Yeah.
the other way, which kind of
Okay.
Wait,
leads me to
Fadwa,
believe.
you put your hand in there and took the placenta.
I pulled it out. Hold on, let me see. I don't remember doing
I don't know
that.
if you wrote that,
I love
but
that
my
we're
husband,
looking at the
like,
notes here. This is like
Yeah,
the bread and butter.
totally
Joey
looking at
said
the notes.
your arm was up to here, and
Okay.
you went in there, but I was like, I didn't feel it. I was like, just
Yeah,
like
it
do what
does
you
say
guys do.
manual. It does say manual. So I
Okay.
must have gone in there and got it because we were concerned
Yeah.
about the bleeding. We have documented that she had 1100 cc's of bleeding at that point. So it was a pretty good amount of bleeding, like right away.
How are you
And
determining the amount of blood? Because like, so in my experience in home birth settings, like, I mean, my sister specifically, actually, she had a pretty solid amount of blood. And she was an L&D nurse before, so she was like
is she
actually
weighing it?
monitoring her bleeding more than no, she wasn't weighing it, but she was taking a look at it and she's like,
Yeah.
that's a pretty good amount.
Yeah. I
Like she
mean,
wasn't putting like 1100 cc's. And so I'm curious how you're putting like an amount
a
on it. Are you
number.
picking up a blanket and actually weighing
I'm
it,
I'm
or
picking it up to see what it feels like to me. We're not actually weighing it. I've just been doing it
okay.
long enough. And I imagine like
Yeah, of course.
a little medicine cup is 30 cc's. So I think
Okay.
of how many medicine cups full of blood would it take to like put this much blood on here? And sometimes there's big clots and stuff like that. So we know that it's off. Whether we're underestimating or overestimating, I have a tendency to feel like we're overestimating a little bit. But we're also seeing a mom who's feeling dizzy and weak and lightheaded. So you got to kind of look at the whole picture. The sooner
And
you
so
get
for
the
me
Right.
as a
placenta out,
non-medical professional, that's what I'm monitoring always, right? Like I do look at the amount of blood, but my main thing I'm watching is her color, her, ability to maintain eye contact, her ability to
Responsiveness.
communicate, her responsiveness, her ability to engage, these types of things, along with the blood, but not necessarily trying to actually measure the amount.
yeah.
Well, and correct
Yeah.
me
So
if
that's
I'm
how I
wrong,
do it.
because every woman is so different, like whether it's height or weight or size. And so me losing a little bit of blood could make me feel a lot worse than, let's say, you losing the same amount of blood and you're feeling fine,
And
as
what are
if
you
I'm
starting at?
correct.
How was your diet during your during your
Exactly.
whole pregnancy? And what were your lab values? Like in the hospital, they check you, they draw your blood when you sign in. Well, we home birth midwives, we do one at like 36 weeks. So it could be 4 to 6 weeks since we've checked what it is. And if it was low, you've had all that time to bring it up, but we don't actually know what it is that we're starting at. So
Right, right. Amazing. Before we continue, Fadwa, I made a note because you were talking about your own births and you were discussing like free birth and all of these different complexities, and you had two free births and then the rest of the births that you had were attended by various people, and you said that you had some thoughts, um, and I just want to know if you
yeah,
remember what those thoughts were
I
and
do.
touching on them.
So I read this amazing book recently called Eve. Has anybody heard of it or seen it? It's
Mm-mm.
really,
No.
really worth reading. It is a
Okay, cool.
cultural anthropology that writes about our history, think of our like Darwinian sort of evolution of species from the perspective of the female body. And it's fascinating. And I believe, and what she says in this book is that we made this leap from being not human yet to human. What helped us make this leap in evolution was midwives and midwifery. And when the first woman helped the next woman to give birth, it gave us the safety and the ability to then like have our population increase to the point where we could now start moving around and interbreeding and creating people. And I just like when I read that, I think about that in terms of like the free birth, the whole free birth thing. And I just feel like we are not meant to do this alone. This was meant for us to be together. Women are not meant to birth in solitude.
Yeah.
You need someone to feed you. You need someone to protect you from predators. You
Like,
need
what
someone
someone told
to,
you.
I mean, it's just so, so important. And yeah, I don't
And the
understand why
nuanced
we're
layers of how
encouraging
that can
people.
happen, right? Like I think of my birth with my daughters, and an element that I wove into that is community through having a teepee full of people in my backyard praying and singing around the fire. And I could hear the drum out there and I could feel their presence and their support, right? And so it's like even that kind of layer of, yeah, community as the foundation, right? So beautiful. And that support and that togetherness, but it doesn't have to be like a crowd of people around your bed either. And I think you're really speaking to a very important thread, which, Karina, I feel like you were very intuitively bringing that into your birth when you were like, I want my friend to have the medicine of witnessing, like, and that's perfect for you because you get to choose that and you get to choose that felt good and that felt right and that felt exciting, where the next woman or someone listening might be like, oh my God, no, like I don't want extra people in my birth space. And that's fine too, but just the energy of support in general, I feel like, yeah, for me, I was kind of wanting a free birth-ish, but I wasn't actually ever able to even consider it just being me and my husband, right? I wanted it to be sovereign. I wanted it to be mother-led, but not once actually did it cross my mind that I wanted it to just be Mike and I, like I always understood that I wanted the entirety of the space to be held, for somebody other than my husband to be the one doing the logistical stuff, emptying my purge bucket, putting more hot water in the pool, putting wood on the fire. Just there's so many things. Like a birth space is very dynamic and there's a lot of movement, even though it can, come into some stillness in moments like you were speaking to Karina's needing that moment of stillness, right? But yeah, support. I
Hmm.
And
I
I
I
feel
think
like
it's so beautiful.
so many women are drawn to the Free Birth Society because they're looking for this support. It's just not the support that they're not getting that support. They're getting some other
Right.
type of support, which maybe fills in, but isn't the support. Like with my first, I had a tear. That was pretty bad.
Uh-huh.
And
Uh-huh.
I did find a midwife to come and take a look at me the next day. And at that time, the belief was you couldn't do anything about suturing anything if it's been more than 10 hours or whatever. And so I spent 6 months healing, and it was hard on my body, and it painful and not that much fun. And I wish I had had somebody with me who could have taken care of that for me in the moment. But it wasn't my path. It wasn't available to me.
And I
And
think an
so I didn't
element of
have it.
support, I think an element of support too is a lot of women may choose free birth because the support that's available in hospitals isn't actually feeling
Supportive.
yeah, it's not actually feeling supportive. Yeah.
Yep.
And so there's a problem there, because again, I
Yep.
have a lot of respect for hospitals, why they're there and the work that they do, and there's limitations and they get things wrong. And that's not always the space conducive to a physiological birth the way that it could be,
Yep.
right?
Or it's not conducive or aligned with the type of support a woman wants, right? And I
Exactly.
think that that's like a big thread that I always want to come back to and highlight is the spectrum of support needed in our birth world. It's a very vast thing for so many different reasons. And one of those reasons is I feel it's important to honor the type of support a woman is seeking because she's in a very specific moment in her life, in her journey, in her path that's being influenced by the specific experiences that she has had in her life. And so the idea that women are supposed to feel safer at home, that ideology, that rhetoric, that semantic in and of itself is harmful to women who just aren't in that state of consciousness, and they really truly feel like they want to go to the hospital because that's where they feel safest and that's the type of support they want, right? So we need the spectrum. There's value in the whole spectrum. And, like you're saying, Fadwa, like the hospital isn't going to provide the type of support that a lot of women are seeking. And vice versa. So it's, how can we be mature and humble enough to honor that truth? And then, I feel like what can happen for birth workers in that is that we can honor our unique path as well. Like, I don't have to become a licensed medical midwife or nurse midwife in order to have something to offer to birthing women, because I'll serve very specific women, and maybe something will arise in a moment, but I am also humble enough to seek the care and move somebody to the hospital, into the system, when that's relevant and necessary. And, and vice versa. The OBGYN serves a purpose. The doula, I read a post on Instagram and recently, and it was saying something along the lines of, there might actually be more value in having a doula in your birth that's only attended a couple of births than a doula who's attended 1,000, right? Because what do they bring in, right? What are the subtle energetics of what those experiences elicit? There's good and bad. There's nuance to both, right? So yeah, I just love to highlight this piece and kind of just widen the spectrum, widen the conversation, and actually validate the path that every woman and birthing mother is walking, as well as the different paths of different birth workers across the spectrum, because it all fits somewhere along the line, I trust in, people finding their care providers.
Yeah.
Or I have a prayer that people will find their care providers.
And
obviously there's harm in birth happening every day, but
yeah, and I want to offer just a reflection of listening, Karina, to you, and Fadwa, to you as well, as you're discussing even like what happened with the placenta and integrating these memories and the birth experience, and how important that piece is as we connect with our care providers. It's not just who do we feel safe with interfacing in the birth space, but can we show up afterwards to have these integration conversations, which you were doing. You were going over your notes, and you were sharing like your memories and your partner's memories of, her arm was this far up and all of these various things, and being able to discuss and listen to one another, and then be humble and be like, oh yeah, I remember this, or I don't remember that, or and just how much beauty and like real medicine there is in just witnessing you two discuss those details, And it's just been so beautiful to have you both here and to listen to you and to share this amazing story. And I'm wondering if, we're at the hour 43-minute mark, and I'm just curious if there's any, final comments or things to share before we wrap up.
As I was processing my birth, the following few days and weeks, and parts of it felt like a lot. Not heavy to say, but it felt like a lot. But then at times there were so many beautiful, fun, like funny moments during my birth. And yeah, it was all beautiful. There's one I wanted to share. I don't know if you remember this one, Fadwa, but and I'll leave it with like a funny note, because I feel like that's who I am. But my husband was praying downstairs with his tobacco by the fire, and he starts like crying. And have you heard the story of Inanna, the goddess Inanna? So it's in one of the pregnancy books that I have, and we read it together during pregnancy, and then he read it to me while I was in labor, like maybe day 2 or 3. And it talks about like she goes into the underworld, and it's really to retrieve her baby. And he was by the fire. He's like, oh, she's not here. She's not here. She's going to retrieve her baby. So he comes up and he's crying, and I was in the toilet, like facing the wall, the dilation station, what they call it. And I'm just like in it, and he's crying, and Fadwa comes in, and she's like, "Oh, honey, like just let the tears out. It's okay to feel." And I'm like, "That's not me." I'm like, I'm so strong, and it's my husband crying at my feet. Just he's like, and Fadwa's like, "Oh, that doesn't really happen that often." And like it was, so I was like, it was not me, but I was just laughing inside. So, and it's just, it was it was just a beautiful memory. Like I tell everyone that memory, and it was just like as hard as it was just yeah, very memorable, so expanding, so light and joyful, and just appreciative of the people that were there laughing with me and holding my hand and just being in that space. Yeah, and I just appreciate this space too. The you too. Oh my gosh. I don't know how to say how much I'm so thankful. Like literally every episode I've like listened to, I just feel like I'm growing in wisdom and crying and expanding and just all the things. And I feel just very connected to you too from afar, and really excited of everything that you're talking about. And it's super important because even everything that you've shared, I feel like I can hold better space for mamas. Just even this, this couple weeks I supported a mom, and just because of your podcast, I was able to hold even more space and just not try to fix anything, just really listen and be there. So I just
That
want to say
means
thank
so
you.
much.
You
That
guys are
means
doing
so
amazing.
much.
Yeah. Yeah. So you're doing it. So
Oh,
keep doing it.
thank you.
Thank you so much.
Yeah,
Really.
I
Yeah,
just want to
that's
take
a
words to Karina, thank you for inviting me on here. It's an honor to be your midwife. It's an honor to be your friend. It's been an honor, like listening to you guys' podcast. I don't listen to that many podcasts, and I listen to every episode. There were so many things along the way that I resonated with, and I was like, oh my God, me too. For instance, I was sure that I was going to die with my last baby. I didn't tell anybody because I didn't think anybody would be able to hold that. And that's a whole nother story. And I did not, and she did not. So we're all good. But also really curious, Emma, what what the midwives said to you that you interviewed before you decided to do your free birth. Like, I would just love to hear, like,
Mhm.
what it is. And one last comment from this, I've already talked to my team. I said, I've been listening to this podcast, and like, I'm quite sure we need to sit down and we need to figure out how we can bring more heart into what we're doing. We've got the medical stuff down, we're doing all this great medical stuff, and keeping everybody safe, and we have our protocols, and that's all well and good, but I feel like we're losing the heart, and how do we keep that in a team environment, so yeah, I'm going to be
wow.
watching for future episodes to see what comes. So
Oh my God. Thank you so much for saying that.
Y'all, just so you
We're
know,
4 episodes in. Like what?
yeah, just so you know, Fadwa's in like this two office space and is getting this new space where she's gonna have tea with the mom. Like, so just please, if you can pray for Fadwa and getting this space up, and just I'm so excited for her and the families and mamas that are gonna really connect with her and
Mhm.
support, and
Oh, please,
because of y'all too, it's like happening too. So
You guys, wow.
you are welcome anytime. If there's a topic, a
I
story,
was just gonna say
like,
this.
please come back. I've cried so
Please.
much just listening. Like, stop, like my blanket is wet. Like, I'm really grateful for both of you being here, and please come back if that feels, if you're feeling called, if it's pulling at your heart in any way, because these conversations, I really do feel they're so important. And yeah, to answer your question, Fadwa, just before we, say some final thoughts, um, I mean, a few things that the midwife said where I was like, oh my God, no, was there was a lot of indirectness, and that's the majority of what it was. It wasn't one specific thing. I asked very specific questions on when do we transfer, what, like, how do we do all these things, and she said that she doesn't want to answer right now, that, and it was just a very Well, and it was just very wishy-washy and not anything like concrete. She wasn't telling me what the protocols were. And I was more looking for specifics of we might transfer in this situation, or even every circumstance is different. So we don't actually know in the moment. We can discuss this more. It wasn't any of that. It was just this lack of answering. And that instilled for me a very strong distrust down the road. And I've since spoken to her, and any future births that I have, I'm like, she's one of the first on the phone that I'm going to call, because we've deepened a relationship and I've shared these things with her. And I've learned more about her since then. But that lack of directness, was really concerning for me. And I had a whole list of questions because I was really wanting to understand, like, who am I inviting into the birth space here?
Mhm.
Yeah. 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 Thank you. Thank you guys so much. Sam, are there any final things to share?
I mean, yeah, a lot of gratitude for you both. Echoing, please come back with conversations, anyone from your midwife team, come and have the conversation live about how you can bring more heart into
Mhm.
the practice. I love that thread and I love that prayer. And yeah, I just feel so grateful. I feel so humbled, honestly, a
Yeah.
little bit overwhelmed by the energy that's coming through here, and just a prayer that's being answered in the wake of these conversations that I've been craving, so deeply. And it's it's such an answered prayer. And so I just leave my last words are words of gratitude and a prayer for the continuation of whatever this project is and is becoming. And
I love it.
Yeah.
Feel free to reach out anytime.
Likewise.
Yeah.
Yeah. Thank you so much. And
Thank you.
just
any final thoughts, Karina?
I love you guys. Love you, and so much gratitude. And thank you. Just thank you for providing the space for me as well. Yeah, thank you for being the first, public place where I get to share my story.
amazing. Thank you. And
Thank you.
yeah, receiving that love and sending it all the way back. All the way back. Okay, amazing. To all the listeners, thank you as well. We really appreciate you being here. We appreciate this community that we're still just in the preliminaries of building. And as always, the comment section is completely open. So share your questions, your thoughts. If you want to share your story as well, this is a space that belongs to everyone. It's not just an Emma, Sam podcast space. This is Birth the Middle Way, and birth belongs to women, every single one of us. So this is your space too.
Thank you.
And thank you all.
I almost wore this, and I think Fadwa is wearing hers, but
Birth belongs to women. No way. Wow.
Birth belongs to women. Maybe that's
And
the
so
title.
the theme, right, in the theme of Birth the Middle Way, we end on a synchronicity because we're here for that.
yep.
Amazing.
Thank you all.
Ladies.
Thank you so
Have a
much.
beautiful day.